This is I Want Second Opinion. Welcome to our channel. I Want Second Opinion has been growing slowly and steadily, where we have been producing videos of common medical topics. Of late, we have been producing videos of well-being as well. In addition to it, as originally we started, this channel will help you out with second opinion, wherein if you already got an opinion from your treating physician, and if you have got any doubts and you want to clarify any of that, or if you've got any dilemma in making the treatment decisions, you can contact us via going to the YouTube and looking at the YouTube video on how to approach us. Now, today we have got our Dr. Lakshman. He is not anything old to you. He has been with us in the past. He's our gastroenterologist, and today he is with us on the topic of constipation. Hi, Dr. Lakshman.
Hello, Dr. Raj.
How are you?
Yeah, I'm good. Thank you. Hope
Right.
you're doing well.
Yeah, of course.
I can see the growing IWSO.
Thank you.
I'm quite happy with that.
Yes, it's slowly and steadily, it has been growing. Number of subscribers are increasing steadily now, which is good actually. Now, let's jump into the topic, Lakshman. Constipation. I understand this is one of the commonest topics where people do come to you.
That's true. Actually, they don't come as constipation, but we diagnose constipation at the end.
You diagnose constipation at the end. That's interesting to know. Now, in medical terminology or in layman's terminology, how would you define constipation as?
For a lay person, they initially think that it's only if they don't go to the toilet every day, it's constipation. Not
Okay.
necessarily. So it depends on the habit. For a person who is going twice a day, if he goes once a day, it looks like constipation. For a person who is going twice a week as a habit, that's fine. So it depends on the change in the habit with reducing the frequency of stools as the main thing.
Right. Okay. Which means the definition of constipation will differ from person to person.
Yeah, the number of
stool.
Yeah, that differs, but the basic definition of reduced frequency holds good.
Yeah, that is always there. Yeah, that's right. Yeah. Now, coming to, I suppose diet plays a major role in constipation. Can you explain me the role of diet in preventing or relieving constipation?
Right. One of the important factors is diet. I agree. So, diet has got the basic nutrients and the carbohydrates, fats, proteins, in addition nutrients, and a lot of roughage.
Okay.
That is a fiber content. That is required for propelling the unwanted things out of the body.
Fiber, okay.
So if there's no fiber at all in the diet, everything is absorbable. There will be nothing left. But we need something to expel it from the body. We need something to trap the toxins and take it out. So that is the fiber or roughage.
All right. Okay.
That's very important. And as if we can clear the bowels every day, that's good. Instead of keeping the fiber, toxins, everything for a week and then expelling it.
All right. Okay. So are there any specific food which can either help the constipation, in the sense of relieving the constipation, or any kind of food that can make the constipation worse, which we regularly intake? Yeah.
The common things which good amount of fiber intake are the vegetables and fruits, mainly.
Okay.
Among them, we say greens. Green leafy vegetables are very important in the Indian context.
Okay.
Again, there's something in the coating of the cereals and legumes and nuts. Small fiber coating, which we generally polish it.
Yeah.
So that's actually good for the fiber.
So majority of them we polish it and the fiber content goes away.
Exactly.
Okay.
Same with the wheat. So
Mm.
if you have a brown bread, it's better than the white bread with
Right.
with the
Okay.
contents regarding the fiber.
Right. And are there any specific food which can worsen or precipitate constipation, which people need to be aware of?
The current day Western diet or the fast diet,
Mm.
fast food, what we get, that will
Yeah.
have less of thing, and those who eat usually will not have so much to pass motions, and they end up in constipation.
Right. Okay. Any
Rarely,
particular? Yeah. Go ahead.
rarely, sometimes apple without the skin, that's
Mm.
supposed to cause some constipation.
Apple.
Yeah,
Right. Okay. Right. Without the skin. Okay.
that's because, yeah.
All right. Okay. Now, you mentioned about the food that can cause constipation. I'm sure lifestyle of us definitely has got a role to play in constipation. Are there is there anything that you would be able to mention so that people will be able to modify their lifestyle activities to avoid this particular stuff?
Yeah, basically constipation is due to many factors. One of them is dietary and hydration, what we discussed. Less
Okay.
amount of hydration, some people drink less water. That's one of the
Okay.
things. So
Okay.
dietary, as we discussed. The other thing is the habit. So if a
Hmm.
person tries to control the urge during the young age,
Hmm.
that will prevent the reflex happening. So
Okay.
as you inhibit more and more of
Hmm.
this reflex,
Hmm.
so the body tends to accommodate itself by not opening the bowels and not pushing the contents out.
All
So
right.
that results in constipation.
Okay.
So
So, in this process, is it better to set up a routine on a regular basis so that the bowels get open at all?
exactly. So it's like what we when we have eating, when we go to sleep, so that becomes a routine. The same way, if we can have bowel movements also as a routine, that's good.
Hmm. All right. Okay. Now, there in the movies, in our Indian movies, we see that people associate smoking as an habituated process for opening the bowels. Is there is any truth behind that?
It's conditioning actually. So
Hmm.
people want to link it to smoking or link it to some activity, so that
Hmm.
will remain. But smoking by itself does not promote
So
this
essentially, it is
function.
habituation rather. Yeah.
Correct.
All right. Okay. You did touch upon the hydration, water intake regarding constipation. Uh, is any specific
Yeah,
figure or anything at all that you would like to quote here?
there are some studies which have shown that approximately 3.5 liters to 2.5 liters of fluid is required. Not water, the total fluid intake should be around that.
Total fluid. Okay. In any
Yeah,
modality altogether. Okay.
that's correct. So that is good enough for propelling the contents out. So
All right.
yeah, approximately 2 to 3 liters should be adequate. So if you
Okay.
take less than that, the amount of fluid in the bowels will be less.
Okay.
The
Right.
quantity of this water may be increased during summer or
Hmm.
sweaty conditions, hot
Okay.
weather.
Hmm.
So because some amount is lost to the skin.
Okay. All right. Okay. Now, we did slightly touch upon the what was constipation, but we didn't go into the details of what are the causes of the constipation, Lakshman. Can you let us know what are the common causes of constipation, please?
Yeah, the commonly, as we discussed, the habitual constipation, which we develop it as a habit, and the
Okay.
dietary things where we
Yeah.
don't think. The third important is the IBS with constipations. It's like a um, IBS which can come with diarrhea, the irritable bowel syndrome. It can
Yeah.
have constipation as a predominant uh, manifestation.
All right. Okay.
Other than that, we
Hmm.
got some diseases which can cause constipation, like low thyroid,
Hmm.
diabetic conditions, or
Okay.
Parkinsonism in the elderly. they all can have slowed, sluggish movements of the bowels.
Right.
Some
Okay.
of the medications also can cause, especially codeine or morphine, which are called narcotic analgesics. They have a bowel spasm effect, causing constipation, and some antispasmodics, like what we use for abdominal pains to relieve the spasm, and anticholinergics they can have.
Okay. They can cause constipation as well. So, okay, all right. Does change in the bowel movement at any point of time needs to be considered sinister kind of an event, in the sense that we have to, if suddenly anybody develops constipation, uh, yeah, does it need to be investigated on an urgent basis to rule out any cancerous kind of phenomenon? That's what I want to meet. Yeah.
No, cancer does not manifest with constipation as a main symptom. There will be other symptoms. So, just with constipation, we don't think of cancer. Let us be.
Okay.
So, it's nothing is a symptom.
Right.
However,
Okay.
constipation can result in so many other complications. So, we should be aware of it. A
Right.
few days or a month of little bit of delayed movements for a month should not be to worry. Not passing or not opening the bowls for 1 month. It's not so. A little delayed every day for a month, that should be fine. But if it persists, or if it doesn't open for a few days or a week at a stretch, then wary of it. We should consult the doctor immediately.
Absolutely. Lakshman, thanks a lot for giving us all the insights regarding what are all the causes of constipation and in the next episode. Thanks, Lakshman. Bye-bye.
Yeah. Bye.